Hello, Partnering for Vaccine Equity Learning community members and other partners who are working in the vaccine equity space. Welcome to this afternoon's learning event. I'm Bridget Courteau. I'm the Director of Group Learning for the community. And on behalf of our team at the Urban Institute, thank you so much for joining us. Our presentations today are the third and final session in our September series on engaging young adults. During our first session, which was on September 8th, we heard from Erin Hemlin at Young Invincibles, and she shared new research that her team conducted on why young adults aren't getting vaccinated against COVID or are getting vaccinated at COVID at lower rates than their older counterparts, including reasons they're hesitant about getting the vaccine and the barriers that they face. If you missed that session, you can find the slides and the recording, both which have links to Young Invincibles' new report on our learning community website. And then in mid-September, we hosted our very first virtual office hours with an expert. And once again, Erin returned and joined us, but this time in a small group format to hear about and to troubleshoot on some specific issues related to young adult engagement that Partnering for Vaccine Equity programs are dealing with. Thanks to those who participated in the office hours, and know that we're planning to roll out more events like that to complement our large webinar style events. So today's session will complement the information from Young Invincibles. So we heard about the barriers to vaccination faced by young adults and why some of them have low confidence in the COVID vaccines. But what are learning community members doing to engage them? And what are some promising strategies for increasing vaccination in this population? Our partners at the National Council of Negro Women, or NCNW, have joined us to discuss some of their program activities. But before we go further, I'll do our typical quick review of how this session will work. You've all been muted upon entry to the session. There are a lot of us, so staying on mute unless you're speaking is key to keeping the discussion going without accidental interruptions. And you do have the opportunity to speak your question rather than type it into the Q&A. It's your choice. If you do want to speak your question, just use your raise hand feature and we'll unmute you. So we will be monitoring for raised hands. And if you want to type your question, use the Q&A tab to do it. You can ask a question at any point during the session. We will reserve the last 15 minutes or so of our 45 minutes together for Q&A. And the chat room feature is also open today. We encourage you to chat amongst yourselves as you'd like, but please use good chat room etiquette. And by this, I mean, don't post questions for the speaker in chat because we might not see them there. And though this probably goes without saying, please be civil to one another and to our speakers while chatting. And finally, as with all of our learning events, we'll post the slides and a recording of this event to our community website and through the digests that go out through the CDC managed adult vax program listserv, which hopefully all program members are part of. And finally, if you have technical difficulties at any point during the session, send an email to our community manager's inbox, vaxequitylearning@urban.org, and we'll be watching the inbox and we'll try to help you as quickly as we can. And now it's my pleasure to introduce our first featured speaker, who will in turn introduce her colleagues. Jade Dominique Walker currently serves as NCNW's Data Evaluation Specialist. And before working at NCNW, she was contractor for ASRC Federal, and that's an agency serving the Environmental Protection Agency. And before that, she worked at the Graduate Cybersecurity and Information Assurance Program, helping grad students at the University of Maryland University College. Ms. Walker volunteers as a research associate for the National Organization of Retired State Troopers and the Smithsonian Educational Research Center. She's provided programmatic and technical leadership on various projects and supports research programs focused on environmental preservation and social justice. Ms. Walker also possesses a BS in psychology and an MS in environmental science. So Ms. Walker, thank you for spending time with us this afternoon. Really excited about today's presentations. And I'm now going to hand the mic over to you and your team.
Thank you, Bridget. First off, I just want to thank Urban Institute and CDC for gathering us all together because these matters are important. And it really helps us disseminate information very quickly when we can have these get-togethers and exchange ideas. So thank you. As Ms. Bridget said, my name is Jade Dominique Walker, and I'm the Data Evaluation Specialist for NCNW, the National Council of Negro Women. NCNW is a service-focused organization founded in 1935 by Dr. Mary McLeod Bethune, an influential educator and activist. Our mission is to lead and advocate for, empower women of African descent, their families, and communities. As a service-focused organization, we have collaborated with a variety of government entities, such as the CDC, for other health-related grants in the past. Thus, the opportunity to focus on this initiative, which is to increase accurate messaging, vaccine uptake, and detect factors of hesitancy, has been an exhilarating endeavor for our organization. Currently, there are 11 states in which NCNW members and collegiate sections are hosting activities, events, and programs that are providing vaccine opportunities, accurate messaging concerning vaccines, and reporting hesitancy factors. NCNW is collaborating with 18 other national organizations and subrecipients like Vaccinate Your Family, the Continentals Inc., Alpha Kappa Alpha, Delta Sigma Theta, and other various groups to amplify NCNW's ability to target specific cohorts such as college students, as well as to increase opportunities to receive vaccinations through our partnerships with the National Black Nurses Association and local vaccine administrators. Now, for the introduction of our wonderful speakers, Ms. Derrica Williams and Ms. Amina Woods. Ms. Derrica Denise Williams is a native of Atlanta and currently the Chief Operating Officer for Concepts Inc. in Decatur, Georgia. Ms. Williams oversees several divisions that include commercial construction and property management. She has attended Clark Atlanta University, majoring in accounting and a minor in music education. She is in her second term as the president of the DeKalb National Council of Negro Women section. She's also a board member for the Lakeside High School Foundation National Alumni Chair. She is also an auxiliary board member of EDQ Inc., which is a nonprofit organization that mentors teenage girls from Tri-City High School. And she's also a youth leader at Gospel Hope Church. Ms. Williams is a classically trained flutist, and like many of her other activities, she finds it a joy to introduce this beautiful instrument to students over the years. Ms. Williams is also a founding member of the Stone Mountain Action Coalition, SMAC, and the Anti-Racist Coalition of Decatur, ARCD, along with serving on DeKalb's Sheriff Community Commission on Use of Force Policy Review Committee of 2021. Ms. Williams was honored to receive the 2020 Georgia State Secretary of State Outstanding Georgia Citizen Award, the 2021 Georgia State Senate Humanitarian Award, and the 2021 Georgia State House of Representatives Community Service Award. If you ask her what her best accomplishment would be, she would state, "I have the honor of being called the world's best auntie to all my siblings and little ones. This is my best accomplishment." And as for our second speaker, Ms. Amina Woods, she is a licensed social worker, psychotherapist, and experienced program manager with a demonstrated history of working in the individual and family services industry. Ms. Woods has a master's degree focused in social work from Silberman School of Social Work at Hunter College, City University of New York. She completed her undergrad degree at the City University of New York at York College, where she earned a BA in psychology. For the past 5 years in this industry, Ms. Wood's work has primarily focused on supporting the needs of child welfare involved parents, where she directs a team of parent support specialists. Ms. Wood also facilitates parent support groups, and she also organizes training for foster care caseworkers with the goal of supporting staff in developing a trauma-informed lens when working with parents involved in the child's welfare. Additionally, Ms. Wood serves as a member on the NCNW Health Equity COVID-19 Subcommittee. And she was the program director for a local New York City community-based organization's involvement with the grant-based initiative Test, Trace, and Take Care, led by the Office of New York City's Mayor Bill de Blasio. As the main initiative for New York City's public health response to the COVID-19 pandemic, Ms. Woods led a team of community outreach specialists and resource navigators to canvass New York City's neighborhoods hardest hit by COVID-19. She also distributed PPE gear and engaged community members about COVID-19 testing. Ms. Woods provides psychotherapy for Black and African American adults, adolescent women, and other women of color who are struggling with anxiety, depression, relationship issues, career transitions, school issues, parenting, just to name a few. Ms. Wood's biggest accomplishment and greatest passion is being a mother to her 12-year-old son, Justin. Ms. Wood states Justin is a great scholar and leader, and she continues to learn from him daily. I welcome Ms. Derica Williams, our first speaker, to speak about her project conducted at DeKalb section for NCNW. Thank you. Ms. Williams.
Thank you so much, Ms. Walker, for that wonderful and lovely introduction. And I would also like to thank the Urban Institute and the CDC just for bringing this important platform to the community. The DeKalb NCNW section, earlier this year had an event that we called Kids Against COVID Academy. And we are happy to say that we brought this program to 300 students here in our county. And we noticed that the important information shared during that 3-month-long program was needed amongst college-age students, young adults, and the senior community. So we have adapted the Kids Against COVID Academy to what we now are calling our COVID-19 Education Academy. And upon the completion of the academy, all of our participants, we joyfully call them COVID-19 ambassadors. They are well armed with information from our community partners, like the CDC, like Angels in Technology, like My Esteem. If we can go to the next slide, please. So to demonstrate our impact, our objective is to present science, technology, engineering, arts, and mathematics learning opportunities to students and health education to seniors in our community. We want to impact our collegiate population. NCNW has sections on many college campuses here in metropolitan Atlanta. We are the proud home of several HBCUs, historically Black colleges and universities. And we've got sections located on those campuses. Clark Atlanta University, Spelman College. We also have Kennesaw State University, which is not an HBCU, but it is located in metropolitan Atlanta, and that section on that campus is very active amongst those students, and bringing this programming to those students will not only educate them on all things related to COVID, but also hopefully impact those students that are in their networks. We are also excited about bringing this academy to retired and senior citizen populations. We have found that the reason there is vaccine hesitancy is just simply because of a lack of knowledge. It's a lack of understanding what it means to be vaccinated, what it means to be protected, what it means to be actively involved in your health. The disparities amongst people of color, communities of color, when it comes to health and health equity is alarming. And the COVID-19 Education Academy, the goal is to end or help contribute to lessening those disparities. Next slide. So what we will do, we will address misinformation about COVID-19 testing. We will promote vaccine confidence. We will improve health literacy of students, their families, and the senior community. And I want to go back up to the top where it says impact on student learning, STEAM, career exploration, and improve health literacy. We have found, and this is with our Kids Against COVID Academy model, that when we introduce this, this education about COVID-19 and the vaccine to the children in DeKalb County, we sparked something in those little minds. we walked away from that experience with students who are now interested in going into careers in the STEAM industry. You know, there's nothing like a hands-on approach and a hands-on, you know, atmosphere to light that fire in a young person's mind. And I was very thrilled to find out that we now have these students who are excited about being an engineer, being a scientist, being in R&D, being in research and development. They want to go and tour the CDC. They want to interact with those speakers that we brought in from the CDC to talk a little bit about what it means to in a day in the life of that grown up. And we feel like that will easily transition into the collegiate arena. Obviously, we are dealing with young people who are trying to find their footing and deciding on what their majors will be. Some come into college already knowing what they want to major in, but some don't. And as a result of participating in our COVID-19 Education Academy, we're hoping that if just for one student, if it's just one student who has been impacted so much so that they want to consider a career in STEAM, then we have done our job. Our impact, our community members, the student populations, and the senior and retired communities will have hands-on STEAM kits and materials related to the COVID-19 and vaccine science. We have kits where our participants, they program their own thermometers. We do contact tracing and detection and testing and isolation/quarantine strategies. The last part about the quarantine strategies, we had a speaker come in from the CDC who did a wonderful presentation on the importance of quarantining if you have been exposed, if there is a positive test, and the role that we can play in containing and not continuing to spread the COVID-19 virus. Next screen, please. We engage STEAM professionals in public health, like I mentioned earlier. Our CDC partners were just wonderful to work with. Angels in Technology, that is a nonprofit organization here in DeKalb County, and they are the supporters who came in with the science kits and facilitated the experiment, the contact tracing experiments and the antibody testing. And they also taught the participants how to program their own thermometers. We invited and will invite panelists from the CDC to come when we present this program to college students and to seniors and senior citizens and the retired community. We invite experts from the CDC. We ended each of the sessions with a panel discussion, and our partners from the CDC were wonderful presenters. They presented the COVID-19 epidemic or pandemic, excuse me. They presented the pandemic in such a way that it didn't heighten the level of insecurity, the level of fear, the level of people just being really concerned about the role that we can all play in it. The CDC panelists did a beautiful job of just bringing it home and adapting what would normally be looked at as very high level scientific data and making it applicable and palatable to our audience. And for that, we're definitely appreciative. We will be engaging students and those in the senior community with involving them in these conversations, showing the power of interactive and inquire learning. When participants feel comfortable, and we notice that as we progress through our Kids Against COVID Academy series. It was a 3-month-long series, and we met with the students once a month on a Wednesday for an hour and a half. And we noticed that as we progressed through the sessions, our students became more and more active. They became more and more engaged. They saw that this is a safe space. Answering the questions that they had when it comes to interacting with students in their on their campuses who may have tested positive. We talked about the mental health, the internal challenges that we all suffer with when we have either been impacted by someone close to us who has tested positive, or we just turn the news on. We turn on the TV and we see how this pandemic is, has impacted our world. And that can be overwhelming. That's a lot to digest. And having a safe space to release all of that is what we aim to provide. And we just learned that as long as we kept it interactive, the students, and we know that this will transition over into the collegiate arena and the young adult arena. As long as we kept it interactive, then they trusted us, and they trusted the information that was being passed on to them. And that trust translates into being vaccinated. Next slide, please. So the National Council of Negro Women takes an active role in improving health literacy amongst students at colleges and universities, specifically historically Black colleges and universities, and the retired senior citizens in our communities. With established partnerships with schools, health centers, businesses, and medical companies, we're able to dispel COVID-19 vaccine myths and misinformation. That is our purpose. Next slide, please. Well, I want to end with thanking again the Urban Institute and the CDC for providing today's platform. I would like to encourage everyone who is privileged to be with us today to take what's heard today and help us help the community. If there's anything the CAB NCNW section can do to help get vaccine education out in your communities, please don't hesitate to let us know. I'll be more than happy to share my contact information. The disparities, again, amongst communities of color is alarming, and we can actively play a role in helping to dispel a lot of the myths and the misinformation that's out there regarding COVID-19 and the vaccine. Thank you for allowing me to speak with you today. I am honored to share this space with all of you. I come to this work with a goal, and that goal is to make our communities as healthy as we can be. And health exists on a lot of different levels. Obviously, financially, obviously mentally, psychologically, in a health, in a sense of health, and anything that I can do, and anything that the DeKalb NCNW section can do to contribute to this work is exactly what we are called to do. Thank you again, and I look forward to continuing the conversation.
Thank you. Okay, good afternoon, everyone, and thank you again for having me. My name is Amina Woods, and I'm a New York City-based social worker. I'm also a member of NCNW's National Health Equity Committee, serving on the COVID-19 subcommittee. Today, I'd like to share with you some of the process of our subcommittee's planning toward our current initiative. When we convened in the spring of this year, our subcommittee members voted on what areas pertaining to COVID-19 we wanted to address. What would our initiatives look like? And so we voted and agreed on 3 focus areas. The first focus area being on education and awareness around vaccine hesitancy and vaccine readiness, COVID-19 long-term illnesses, pregnancy in the COVID vaccine, COVID and going back to school. The second focus area is around healthcare disparities, specifically focusing on policy and legislation. And the third focus area is on mental health. We want to bring awareness to COVID causation of mental health and also look into the long-term mental health impacts of COVID-19. So we agreed that our first initiative would be a national town hall series. And through this series, our goal and impact would be a national town hall, our goal and impact that we hope to make is to offer evidence-based information on vaccine readiness, mental health awareness, and the importance of vaccinations to minority communities, with a particular emphasis on the full spectrum of children from grade school through college, women of color, and those who suffer from mental health challenges. So once that part was figured out, we then set forth on planning for our very first town hall, which was our COVID-19 and back to school town hall that happened in late July, just a few months ago. But during the planning process, our committee chair, Dr. Angela Elgin, realized that the voice of the youth, the adolescent, the collegiate population, that voice was missing in our planning. We needed to hear from them. So for our town hall, we ended up planning for breakout sessions during our back to school national town hall. And each breakout room was to be specific to 3 groups, ages 0 to 5. Then we had grades K through 12 and the collegiate population. But it was recognized that we can't share info and answer questions specific to collegiates without hearing from them first. This had everything to do with the fact that when communicating with adolescents and young adults, it's never really a good idea to talk at them, right? For this group in particular, active listening can be most beneficial. So we recruited college-age students for a focus group. We had a focus group just a few days before our town hall. And we invited them to share their thoughts, their feelings, and their experiences around COVID-19 and the vaccine. They were a mixture of high school rising seniors, rising college freshmen, and students transitioning to their second year of college. The conversation was insightful, and I learned a lot. They reflected on the social emotional impacts of remote learning. It was tough for them. It was a challenge for them to adjust to their school-based social lives to a remote online platform. Additionally, each of them noted an increase of downtime, and there were not as many places to go or people to see. And so this created a time of inwardness for them. So there was a lot of introspection and self-actualization that was happening during this time of social distance. And they also felt that vaccine incentives were too gimmicky and made them second guess the intention of pairing vaccinations with incentives. For example, the free Krispy Kreme donut with your vaccination shot, or in New York State, if you get your vaccination, your name was entered in a lottery for a college tuition scholarship where your tuition was fully covered. They felt that that was too gimmicky for them, and they agreed that the only incentive that they needed to return to school was to be able to be back with their friends, to be able to socialize in the way that they have always known how to, which is in person. And so the collegiate focus group was inspiring, so much so that our COVID-19 subcommittee we've started planning for a larger discussion with collegiates. And moreover, to be honest, the data from our back to school town hall rather proved that we need to have a separate conversation with them, because the 18 to 24 demographic was not represented at our first event, the back to school and COVID. So this was based on the post-event evaluations that each registrant received. So we have some ideas. The first being that in order to impact this group of 18 to 24-year-olds, we need to meet them where they are. We need to go to them as opposed to expecting them to come to us. We discussed how to make this happen. Where do we find them, right? Well, we're going to tap into our resources. NCNW has collegiate sections all over the country. And so our plan is to request the support of our collegiate sections in organizing another national town hall across college campuses. We're still very much in the planning stages of this idea. And some things that came up was to make this a hybrid event where we'll have a live online platform and have at least one school who will host an in-person event, of course, all considering COVID health and safety regulations. And through this event, we also want to be able to develop a repository of campus resources for collegiate mental health, health and wellness, and financial empowerment. So many colleges and universities across the country have implemented mandatory vaccinations for students. This is definitely the policy in New York State for our public city and state universities and colleges. And since possibly the majority of college students must be vaccinated, it would appear that we would be preaching to the choir, right? But there is still so much to learn about COVID-19 and the vaccine, especially because COVID-19 and vaccination information changes so frequently. And collegiates have influence. They should be considered as trusted messengers of this information. They have influence on their peers, collegiate and otherwise, and family members. In fact, they have influence all over the world. We live in an era of the social media influences culture. And so their influence can potentially hit all corners of the globe thanks to social media. I have a 12-year-old, and while he's not college age, the personal choice he made on his own to be vaccinated played a major part in my decision to get the vaccine. And I'm done, but the last sentence that I'll say is that we should be trusting the voice of adolescents and listening to them. Listening to them empowers them, and they definitely have the power to help fight this COVID-19 vaccine. Not the vaccine, the COVID-19 pandemic. Thank you.
Wonderful. Thanks to you all. And we have around 10 minutes to, so we're going to launch this poll in a minute. We'll just let this slide rest here though while we do our Q&A. So we have about 10 minutes for questions and answers. So I want to remind you to put your questions into the Q&A, or if you'd like to speak your question, raise your hand. And I'm checking now, I do not see hands raised. So type your question into Q&A. I know a couple of questions came in and Ms. Walker has been answering them as we go. Yes, we will have a recording of the event, and I know there's some examples of what's in the STEAM kits too that you all can take a look at in the Q&A. Those should be available for you to see. But as we're waiting for more questions to come in, I know one thing that we've spoken about a lot, what a lot of Partnering for Vaccine Equity programs are doing is trying to kind of forge partnerships in the community with places like schools and other kind of institutions that might be trusted or where the target populations are. So kind of what are your top tips, or if you have just one or two top tips for kind of forging a partnership potentially with a new institution, how to go about it?
I would love to answer that question. I am the recipient of some beautiful friendships. I've got the network of community leaders in DeKalb County have proven time and time again since this pandemic that they're committed to fighting the inequities in our community, and they put money behind that support. DeKalb County's the government, our CEO, awarded us a grant. We received a $40,000 grant from DeKalb County, and that helped to fund the purchases of the kits. And the kits included PPE. It included, there was a battery operated controller, and I have to look at my notes because I am not a scientist. However, I had a lot of fun with the students, making my own thermometer and doing contact tracing and antibody testing right along with them. And of course, we brought in some subject matter experts. Angels in Technology, that's the company that provided the kits. They also facilitated the experiments. My Esteem, that is an organization that was founded by one of our very own NCNW members, Jahari Soward, and she partnered with the DeKalb NCNW section, and she and her company and some folks associated with her company, they are the ones that facilitated the contact tracing and the antibody testing. I think if you cast your net wide, you will reap the rewards of drawing in companies and people who you don't even realize are have you on their radar. The pandemic is important to so many different communities of people, both in corporate America and in the government sector. And I was just thrilled when we were unfortunately at the end of our programming for the students, and I was still getting phone calls from people who wanted to partner with us. And that's why we decided to tweak the program a little bit and bring it to communities of young adults and the senior communities, because we've got the support.
That demand is really heartening to hear about. It really is. So, and I imagine because they're also getting something from these kids too, the school systems are,
Yep.
right? This is helping them
Yep.
Boost their STEAM education. So thank you very much. Another question that's come in, and this is, I think, an important one when you think even about our kind of young adult series. It has been disproportionately kind of focused on kind of college students and sort of educational institutions. So do either of you have insights on effective outreach to the young adult population that are not connected to those institutions? So it could be a little out of your wheelhouse if this is what your programs have been focused on, but if you do have any insights here, invite you to share them.
Sure, I'll speak to that. So just as I mentioned a few moments ago, right, our collegiate age students should be trusted as credible messengers. Their college friends aren't the only friends that they have. So we can share this information with them, educate them, bring awareness to them about the COVID vaccine and the COVID virus, so that they can bring it back home to their friends and their families and their peers in their communities. I think, in my opinion, that would be an idea that I would have as far as how we can reach non-collegiate adolescents.
Just to piggyback on what Ms. Woods said, we also partnered with Uber NCNW as an organization. Partnered with Uber because we understand that if you're a young person, transportation is definitely going to be an obstacle, especially because you probably don't have a job where you can just take leave. I think the young Ms. Hemlin mentioned that about the certain people who couldn't take off, and that would be a reason why they wouldn't be getting vaccine uptake. So if you're a partner with us through our grant, we can afford to offer that promo to in your event. And what we've done is we've made sure that I believe Uber offers 4 free rides. So again, if you get the Pfizer or Johnson, you have to come back for that secondary ride. And again, we wanted to give a little wiggle room if you needed to make ends meet in order to get that vaccine. Maybe you have to go and register first and then go back home. So we just wanted to add a couple extra rides there. We've also made sure we work with departments of that work with child welfare. Prince George's County in particular has linked up with their Department of Health, which is definitely suggested by the CDC, to make sure that we're announcing this information, because a lot of people are just not aware of the resources. It's just trying to get people aware that these things are out here and this is how you utilize them. So yeah, just different ways to kind of address those individuals who aren't in those certain institutions that, we have a straight pipeline to.
Yeah, and I see that you're kind of talking about some activities that are both kind of getting at that confidence issue, but also the barrier issue. So trying to two-pronged approach for the young adults. I'll follow up because I just see a question here. Could you follow up or provide any more information about your Uber contacts? Doesn't have to be right publicly, but looks like there's a attendee who's interested in learning more about how you went about that. So you might be able to follow up offline, unless you have a quick tip now.
I don't have a quick tip. That was definitely a power move, I will say, by a philanthropy department.
Okay.
But please reach out and I will definitely follow up and see what we can do. Please. My email's in the chat. I'll throw it in again.
Awesome. So I think we have time for maybe one or two more questions. And one that came in through the Q&A. For any of you, have you seen commonalities across communities of color? So whether it was the Latinx Hispanic community or the American Indian, Native Hawaiian, Pacific Islander community. And so this posters that I feel like there could be intersectionality between communities of color on outreach for young adults. So are you either doing partnerships that you could speak about, or have you kind of noticed commonalities that you think the community could leverage as they do their work?
Please, Ms. Williams.
Well, I just wanted to say real quick that we will be partnering with the Georgia Hispanic Chamber of Commerce, and we're not sure what that will look like. We know that the platform will be vaccine education, and we actually have we've got a planning meeting scheduled for next week, and I will definitely keep you guys updated on the outcome of that. I was thrilled when they reached out, and I do believe that there is some intersectionality between our community, meaning people, African Americans, and the Hispanic community, and just trying to leverage the contacts, the community support, from the business support, the government support, and present what we have at one time to a larger group, I think will be a lot more impactful. And what better way to do that than to partner?
Wonderful. So we have just a couple of minutes left, and I'm going to ask Zara to launch our satisfaction poll. So before you all sign off, if you wouldn't mind just filling out this quick poll for us, and to our speakers, Ms. Walker, Ms. Woods, Ms. Williams, we really appreciate you taking time this afternoon to share with the community. We have 1 or 2 more minutes. If you have any kind of final remarks, I want to remind everybody that our materials will be available on the website. That's also a good way to find some of our speakers. Hopefully our speakers are also on our website and have profiles there. You can search for them in the peer directory and message them that way. So if you see people on these events and you want to know how to reach them to ask follow-up questions, that's a good tip. So any final thoughts before we close the call?
Don't hesitate to reach out. There is no organization too small. We speak with any individual because every organization has some reach to their cohort, whether it's young, religious, Spanish, Asian, it does not matter. We are interested in working with anyone because we are stronger as partners. We all know this and we say it consistently, but it's very true. To Ms. Williams' point, we really try to bridge where we can. And it doesn't mean we have to go in a grant together. We could just host an event together. And that could be a great way to get our populations to come together. So that's just my 10 cents.
I think that's a great point to end on. And it looks like Ms. Woods and Ms. Williams agree. So I did see a question coming up in the chat about our website. So let me just add that, because I know we have some audience members who are not part of the Partnering for Vaccine Equity community, meaning you are not funded by the CDC through that program, but you are partnering with an organization that is. You might be a section of NCNW, for instance, that isn't getting direct funding. So if that is the case, then you will not have access to our website. Our website is private only for the Partnering for Vaccine Equity program members funded by the CDC. However, you're here because you know someone who forwarded the invitation to you and is a funded partner, and they can help you get access to recordings. So soon our recordings and event resources will be available to the broader public, but right now they are only on our website. So you will have to reach out to somebody who is part of a funded program, and our speakers are. So, and Jade shared her information. So she can forward requests to us and we can help you out with that. All right, thanks all. Really appreciate, again, you spending part of your afternoon with us, and stay tuned for more learning events. Thanks again to our speakers, and have a good weekend.